As you can probably see, we're going to be talking about our different heart surgeries today. So first, we're going to just jump right in with bypass surgery. Bypass surgery is going to be our most invasive surgery. It's going to involve actual open heart surgery. So before we get started with this surgery, we're going to want to make sure we're administering our anesthesia because we do not want our patient to be awake for this when we start sawing into their chest. And then we're going to go into actually opening the chest cavity, and this is going to be called our sternotomy. And we're actually going to take a saw down into the sternum to open that chest, to get to that heart. And then once it's open, we're going to use our clamps to hold the chest cavity open. And then we're going to want to redirect our blood, and our heart is not going to be pumping for this surgery. So it's going to be completely still. So we need to make sure that something else is pumping blood through our body for us. So we're going to be redirecting our blood. Sometimes we'll redirect it into the mammary artery or surrounding arteries around there. And it's going to be redirected into a pump that's going to oxygenate our blood and return the blood to our body. This pump is essentially going to be working as our artificial heart for this surgery. And then once we're doing that, we can actually go ahead and harvest our blood vessel. So someone's going to take this large needle, they're going to make an incision on both ends of the leg, typically because we're going to be harvesting the saphenous vein more often than not. Sometimes it can be a vein in the chest, but more often than not, it's going to be our saphenous vein because it's our longest vein, and we can live without 10 to 12 inches of it. So once we do that, we're going to snip both ends of it, and then we're just going to pull it out. And after that, we're going to move into actually suturing this blood vessel, but we're going to make sure that we're cutting sections of the blood vessel for however long that we need it, because we probably will not use that whole 10 inches. So you can see by this picture that I highlighted the suture where we actually stitched the saphenous vein onto the heart, onto those blood vessels. So right below it, you can actually see the blockage underneath where the atherosclerosis is. And we're essentially just going to be suturing the blood vessel on one side of it where the blood vessel is in good condition, and we're going to be stitching on to the other side where the blood vessel is also in good condition. So we're going to be essentially just completely rerouting, bypassing. It's like taking a different exit on a highway. So after we do that, we're going to get the heart started again after we stitch up the chest. And oftentimes the patient actually will be walking the day of this surgery. So after that, it's pretty easy from there. Long recovery, but we got it done. Now we're going to go into our less invasive surgeries, and we're going to start off with angioplasty. Angioplasty is going to be requiring us to make a suture, or not suture, a incision into the femoral artery or in the wrist. And we're going to thread up a guide wire, and it's going to have a camera on it, and we're going to be able to see where we're going, threading that guide wire all the way up into the artery that is blocked in the heart. And then we're going to have a catheter go up with a deflated balloon on it. And once we thread it all the way up to where it needs to be, someone is going to blow on the other end, and it's going to inflate this balloon. This balloon inflated is going to, you can see by the picture, it's going to press the plaque against the artery walls and compress it, so that then when we pull the balloon out, the blood flow can be restored. So yeah, after we blow into it several times and get that nice and compressed against the artery wall, we're going to pull this balloon out, and nothing stays. But now we're going to move into it talking about a stent. A stent is very similar to angioplasty. It requires us to use angioplasty to place a stent. But a stent is a bit more permanent because we're not only going to insert a balloon up into the blocked artery, but we're going to have a small mesh tube that is surrounding this balloon. And when you blow into the balloon, it's going to not only expand the balloon and compress against the plaque against the wall, but it's going to expand this tube of mesh. It's a metal mesh tube. So once we expand that, the balloon is going to get pulled out, but as you can see in picture 4, the stent is going to stay in place and blood is just going to be able to flow normally through. So that one's a bit more permanent.